Hi everybody, in this video I'm going to try and demystify myths which are very prevalent with the general population. This is Dr. Ravindran Kumeran from Apollo Firstment Hospitals, Chennai. I am a surgical gastroenterologist and I hope this video is useful. Yet another common misconception is that having a mesh with the hernia operation can be counterproductive in the long run. Now, what do I mean by a mesh? A mesh is a artificial plasticky kind of material which is inserted into the patient's abdomen so that it creates scar tissue which will indirectly strengthen the muscular layer and therefore prevent a hernia from coming back. So earlier, if you go back 75 years, there are so many misconceptions. People who have had hernias are advised to take rest at home for prolonged periods of time. They are not allowed to cough. They are not allowed to lift anything for a lifetime because of the high prevalence rate of the hernias coming back. In other words, the hernia recurring for the patient. You may have heard patients complaining, saying, quoting about the relatives having to have 4, 5, 6 operations for the same hernia, and that is true. Now, with development of science, with the development of understanding of why the patient has hernia recurrences, the present standard of care worldwide is to have meshes put in as part of the repair. And these meshes are often non-absorbable mesh. What I mean by that is they stay in the patient's body for the rest of their life and they get integrated in their tissues. Meshes look like mosquito nets. They have holes in them, so the tissue is able to grow through those holes and they get completely integrated in the system. If you go back into a patient for whatever reason, if you try and undo the mesh, it is not possible. You cannot take it off as a layer because there is tissue in growth. So these meshes have been proven to give fantastic improvement in tissue tensile strength, and therefore the chances of recurrence are significantly low compared to when the same patient has these operations without meshes. Now, this is beyond doubt worldwide that meshes are the standard of care for any hernia unless the hernia is minuscule in size. All other hernias have to have meshes unless there is a clear contraindication. Now, if you have infection, then you can't put in a mesh because the mesh will also get infected, and often those patients will require one more surgery at a later stage because those hernias will invariably recur. So otherwise, meshes have become the standard of care, and there are different qualities of meshes. Some scenarios will require special meshes to be put in and so on and so forth. That will be a topic for another day. But the rule of thumb is without a mesh, hernia recurrence rates, meaning the failure of hernia surgery, is extremely high. So please do not have this hesitation about having a mesh put into your system. It often completely integrates into your system. And if you are somebody who is particular about having the minimal of scar tissue, for example, if you're an athlete, if you're somebody who does a lot of exercises and you're worried about perceiving the mesh when you're doing exercises, then there are always what we call as lightweight meshes where the amount of foreign body you put in is significantly less compared to a standard mesh. So you can mix and match for which patient you're applying the mesh on, and that can be discussed with your surgeon. But general rule of thumb, without meshes, the hernia recurrence rates are much higher compared to operations which are done without meshes. Thank you.